Let me use this opportunity to call President PSK, Dr. Mashogu, to invite our next keynote speaker. Thank you.
This ED maneno has nothing to do with me. Yeah? Ama was it VD? Esteemed colleagues, ladies and gentlemen, good morning. Good morning. Yeah, so today is the last session. I'm really excited. It's been a great week. So part of today's activities around closing, and so we have a whole afternoon session for closed door for both ISP members and also PSK members. I'll just like to request you all to just make time for that. We have a couple of exciting things to discuss in the afternoon. I'd share the agenda in your WhatsApp group, so please just refer to that. We'll also be having a press conference. I think those who will attend the press conference have been identified, so that will be at 1. Because remember, the press conference after the DP came, all talked about village politics. So now we want to center the country around what we actually were discussing here, in addition to, why we are all here. So without further ado, this session was meant to be run by the chair of the Pharmacy and Poisons Board, Dr. Githinji, who is away on official duty. So he sent Dr. Richard Muthoka, who is the chair of the Pharmacy Practice and chair also of the Inquiries and Disciplinary Committee, of the Pharmacy and Poisons Board. He's also a member of the Audit and Technical Committees of the Pharmacy and Poisons Board, and an alternate representative for the PS Department for Public Health and Professional Standards. So, ladies and gentlemen, welcome Dr. Muthoka. I'm sure you all want to know what EDC means. Yeah? Dr. Muthoka will tell us more about that.
Good morning, all. Morning, colleagues. I'm happy to be here. I'm representing the chair. Dr. Charles Githinji was not able to be with us this morning. And with me, I have the board members. I would kindly ask them to stand wherever they are. So we have two who are not here with us. We have Dr. Sioi, the CEO of PPB, who is the board secretary. We have Dr. Isha Anand, who is a member of the board. We have Professor Beatrice Amugune, and we have Bernard Kimayo. You may be seated. Thank you so much. My name is Dr. Richard Muthoka. I sit in as an alternate representative of the principal secretary at the board of Department of Public Health and Professional Standards. And so the chair asked me to represent him because we're not able to be with us. So basically my duty here is just to read the keynote speech for the chair of the board. So to the president and executive of the Pharmaceutical Society of Kenya, members of the society, distinguished guests, ladies and gentlemen, it is my honor to address this distinguished gathering at the 2024 PSK ISPE International Scientific Conference themed Pharmacists Transforming Policy, Practice, and Patient Care. The theme is both apt and timely, reflecting our collective goals within the Kenyan government's bottom-up economic transformation agenda, universal health coverage, and Vision 2030 for our beloved nation, Kenya. Today, we come together to celebrate the profound impact pharmacists have on healthcare systems worldwide and to explore the future role we will play in shaping health policy, enhancing clinical practices, and ultimately improving patient outcomes. I therefore extend my congratulations to the Pharmaceutical Society of Kenya for leading the organization as this conference and the accompanying exhibition on health products and technologies. As pharmacists, we play a critical role in maintaining the health and well-being of the nation as advocates for the patient safety and quality care. Pharmacists are uniquely positioned to influence policy decisions at local, national, and global levels. Through active participation in policy development, we have the opportunity to shape the laws and regulations that ensure safe medication practices, enhance access to essential medicines, and promote the effective use of healthcare resources. We therefore expect proactive participation of society and its members. The Pharmacy and Poisons Board is fully dedicated to providing conducive environment for issues concerning pharmacy practice and health products and technologies in Kenya. We understand the importance of the robust regulatory framework that ensures the safety, efficacy, and quality of pharmaceutical products reaching our citizens. Ladies and gentlemen, during this period, the Pharmacy and Poisons Board has called upon you as stakeholders to provide input on the proposed guidelines on good pharmacy practice. These guidelines are part of the initiatives towards streamlining practice and alignment with the international best practices. We are also in the process of developing practice regulations to make better provision for practice. We will thus be expecting your invaluable participation in this process. As you know, the practice is ever evolving, and we are benchmarking with other health regulators in process. Key to note is the alignment of our laws with other existing health-related laws in Kenya, including CAP 253 for the medical practitioners, given the close working relationship in the field. As a country, we aim to achieve the World Health Organization Maturity Level 3, what we are calling ML3, by 2025 as part of our implementation of the government's beta agenda. However, reaching this milestone requires the unwavering support and collaboration of all pharmacists across the supply chain. We believe that this event brings together professionals and stakeholders committed to advancing the pharmacy profession in our nation. The annual conference aligns with PSK's mission to empower its members and uphold professionalism and ethics. One of the critical challenges we face in the regulation of HPTs and pharmacy practice is the presence of unqualified individuals, quacks, and absentee superintendents in the pharmaceutical field. It is on this basis that we have adopted a one-government approach to complement the board's efforts towards protecting the mwananchi. I implore all of you to stand with the board in our efforts to eliminate these unscrupulous elements from our profession. As a word of caution, I remind all present to ensure the presence of designated superintendents at your establishments. We must eliminate the attitude that the license does the work as opposed to the person. The PSK is tasked to complement these efforts by playing their role in self-regulation to drain the swamp choking the practice. To ensure you stay informed and compliant, I encourage all delegates to interact with the PPB's new regulations and guidelines, especially those concerning good distribution practices, transportation of pharmaceutical products, and proper disposal of pharmaceutical waste. These guidelines, along with other pertinent to your practice, can be found on the board's official website. Furthermore, I urge the leadership of the PSK to forge a close partnership with the board, both at the national and regional levels. Together we can streamline our efforts, address challenges efficiently, and create a stronger, more unified voice for the advancement of our profession. Let us not forget the significance of adhering to pharmacy practice guidelines, especially concerning prescription medicines and controlled substances. In the wake of emerging trend of non-medical use of prescription drugs in Kenya, I want to urge all of us in this room today to observe and to uphold the professional ethics and standards demanded of us as professionals. Lastly, I urge each of you to remain vigilant in your practice. If you come across any suspicious medical products or technologies, do not hesitate to report them promptly to the Farmers and Persons Board. Your timely reporting can save lives and protect our society from harm. As we look to the future, it is essential to continue fostering a culture of continuous learning and professional development. The field of pharmacy is ever evolving, as I said earlier, and staying current with the latest research, guidelines, and best practices is crucial. By investing in our education and skills, we can ensure that we remain at the forefront of healthcare innovation and continue to provide the highest standards of care to our patients. We are entering the new dispensation of implementation of SHA and SHIF, as was earlier discussed by the CS and the Deputy President. The Farmers and Persons Board is linking its system with the digital health superhighway, which we hope will open the doors for possible inclusion of the benefits of pharmacists. Ladies and gentlemen, the most important contribution you can make to the national development is to recognize your public duty as a professional and as a professional body. The history of this country is replete with associations and professional bodies like ours playing critical roles in reshaping governance and leadership where things are not going well. Choosing today's theme tells me that the Pharmaceutical Society of Kenya is determined to move beyond the individual concerns of its members to the general well-being of the country. As pharmacists, you have the responsibility to care about the welfare of the people whose lives your profession exists to protect. By actively engaging in policy development, embracing innovative practices, and prioritizing patient-centered care, we can drive meaningful change and improve health outcomes for communities worldwide. Together, we can shape a brighter future for pharmacy and ensure that our contributions are recognized and valued within the broader healthcare landscape. Let me end my speech with the wise words of Hippocrates. Wherever the art of medicine is loved, there is always a love for humanity. My best wishes to all the participants in their mission of reshaping the policy, practice, and patient safety for the betterment of all. May the Almighty God bless us all. Thank you so much. I think mine was just to read the remarks, the keynote speech by the chairman, and to say congratulations to the PSK team, secretariat, for the wonderful job that you've done, putting up such a good symposium. All of us have learned a lot, but for the team that I know will be coming in next year, We do not expect the standards to go lower than where we are today. So it's a challenge to all of us. Make sure that you tag someone next year. We are about 800. And imagine all the things that we've been able to learn through the posters, through the presentations that have come. I wish next year most of us will be able to come. Let us find it a challenge for the organizers to get a bigger room so that all pharmacists can hear and learn what we are learning. Thank you.